Hello everyone, very good morning to all of you. So I welcome you all for today's session, and today's subject is ENT. In ENT, we are going to continue a very important topic today, that's nose. In nose, few topics are pending that we will cover today. Okay, so let me share my screen quickly with you and start the session. Can you see the screen? I guess yes, you can see the screen. So I'm continuing nose. In nose, we have already started rhinitis in the last session. I already taught you what is rhinitis. Rhinitis, itis. Itis is the inflammation of the nasal mucosa. Rhino means nasal mucosa. So it is the inflammation of the nasal mucosa. We have already started rhinitis in the last session. We have already started it. So this is the classification of rhinitis. There are 4 types of rhinitis in our syllabus: acute rhinitis, chronic rhinitis, allergic rhinitis, and vasomotor rhinitis. These are the 4 types of rhinitis in our syllabus. In acute, there are 2 types, viral and bacterial. We have already covered acute in the last session. I taught you viral acute as well as bacterial acute. You can see this is acute viral rhinitis. This is acute bacterial rhinitis. In viral, I taught you the coryza, common cold rhinitis. In bacterial, I taught you the diphtheritic rhinitis under a fixed set of heading, and I call this as a master chart of acute rhinitis. We already covered chronic rhinitis also in the last session. I taught you 4 types of chronic rhinitis in the last session: chronic simple rhinitis, hypertrophic rhinitis, atrophic rhinitis, and rhinitis sicca. So these are the 4 important type of chronic rhinitis which we have covered in the last session, in the last episode, under a fixed set of heading, and this is a master chart for the chronic rhinitis. For the details, you must watch my previous episode. Now in this session, I am continuing with the 3rd and the 4th type of rhinitis. The first type, that is acute, it's already covered. The second type, that's chronic, that's already covered. So acute and chronic are already done and dusted in the last session. Here I am covering the allergic and the vasomotor rhinitis first, so that rhinitis will be completed. The complete rhinitis will be done. Okay, so here I am starting first with the allergic rhinitis, followed by vasomotor rhinitis. So here we have made one master chart for acute rhinitis, one master chart for chronic rhinitis, right? And we will continue with another master chart covering the remaining 2, that is allergic and vasomotor. So here you can see my master chart: allergic rhinitis and vasomotor rhinitis. Out of these 2 rhinitis, allergic rhinitis is ultra important. You usually get a long question in your university exam on allergic one. The vasomotor usually come as a short question, and for MCQ both of them are important. Okay, got it? So let's start with allergic rhinitis. With this introduction, I would like to start the new topic, that is allergic rhinitis. So I taught you what is already done, what we are going to study in this session. So we are first going to complete rhinitis. After that, few more important topics are there that I will continue. So first I am continuing with the rhinitis, allergic rhinitis. So this is allergic rhinitis. So allergic rhinitis, first of all, tell me the introduction. Tell me the definition. What is allergic rhinitis? Can you tell me the definition? What is allergic rhinitis? Tell me the introduction. Allergic rhinitis, it's an allergy. It's an IgE-mediated allergic reaction. I will tell you the complete pathogenesis, the complete pathway. You will notice here, it's an IgE-mediated allergic reaction to the nasal mucosa, which is occurring in the nasal mucosa because of certain allergens. Okay, airborne allergens. The person is inhaling the allergen. You know, allergy is type 1 hypersensitivity. So basically, allergic rhinitis is type 1 hypersensitivity. It's a type of allergy, as the name indicates. Allergic rhinitis, it's a type of allergy. That's its type 1 hypersensitivity. So it is IgE-mediated allergic reaction to the nasal mucosa as a response to allergen, airborne allergen. So what's the definition? What's the introduction? Say it's IgE-mediated allergic reaction. It's IgE-mediated allergic reaction to which organ? To which organ? It's nasal mucosa. I'm teaching you rhinitis. It's inflammation of the nasal mucosa. So it's IgE-mediated allergic reaction for the nasal mucosa in response to airborne allergen. So suppose I am the subject and I am having allergy with certain particular pollen grain or particular dust or anything which is present in the air, and I am inhaling that thing. I'm inhaling. So my nasal mucosa is allergic to that. So my nasal mucosa will show certain changes, and that's known as allergic rhinitis. So that's the definition. You must understand the definition. You don't mug it up. Now coming on the types. How many types of allergic rhinitis is there? The allergic rhinitis is of 2 types: seasonal and perennial. Seasonal and perennial. What do you mean by seasonal and perennial? Now there are 12 months in a year. If it is throughout the year, it's known as perennial. You can see from January to December. If it is throughout the year, it's known as perennial. So perennial means symptoms are present throughout the year. in all the months. It is not related to season. It is not related to season. But seasonal is in a particular season. Maybe it is in winters, maybe it is in summers, maybe it is in rainy season. So it is in particular season, because in a particular season, particular pollen grains of the flowers are present in the environment that may be inhaled. Got it? So seasonal, here the symptoms come in a particular season, and the perennial, the symptoms are throughout the year. Compare. Here you can see this, the symptoms are in a particular season, and here the symptoms are throughout the year. You can see seasonal versus perennial. Here, why it is seasonal? Because particular pollen grains of particular flower are of a particular plant are present in a particular season. When the person is exposed to that particular pollen grain, the symptoms will come in that season. So some persons will come to you. If you are an ENT specialist, the patient may come to you and patient say, I am having allergy in a particular season. Only in rainy season, I am having runny nose, sneezing, and all the symptoms of the allergy, not throughout the year. Or some patient may come and giving the symptoms throughout the year. So it is of two types, seasonal and perennial. If it is throughout the year, it's perennial. If it is in a particular season, it is seasonal. So it is of two types. So till now, I taught you the definition and the types. Definition, I taught you it is IgE-mediated allergic reaction to the nasal mucosa in response to the airborne allergen. And types, I taught you it is of two types. What are the two types, people? What are the two types? It is seasonal and it is perennial. It is seasonal and perennial. Okay, coming on the etiology. Etiology, why it happened? There are two etiology. Maybe it is inhaled allergen which is causing this allergy, or maybe it is genetic predisposition. In some cases, we found there is no inhaled allergen. It is genetic predisposition, or maybe both of them. So inhaled allergen, one by one we will take it. Inhaled allergen. As I told you, inhaled allergen are of two types. Seasonal, perennial, which is giving the two types. Seasonal it is the pollen grains. Can you see? These are the pollen grains coming out of the flowers, trees, grasses, weeds. They are according to the geographical area and they depends from season to season. They vary from season to season. So knowledge of pollen grain and the season is very important for the ENT specialist for diagnosing allergic rhinitis. If you are an ENT specialist, if patient is coming to you and patient is giving you a certain history that I am having symptoms per doctor, particularly in this season only. So being a ENT specialist, you must have idea of various type of pollen grains which are present in various season. So you may pinpoint that maybe this is the pollen grain which is the culprit for this patient. So this knowledge is very important for the diagnosis. It is for seasonal allergen. And what are the perennial? Perennial are present throughout the year. Round a year, from January to December, throughout the year. It can be molds, dust, cockroach, animal dendrites, animal denders. So, they are present throughout the year. So that is perennial. So inhaled allergen, inhalant allergen can be of two types. Seasonal mein particular pollen grains are there, and perennial like dust, like cockroaches, animal dender, they are present throughout the year. Now, what about the genetic predisposition? We have noticed if one of the parents, suppose the father or any one of the parent, maybe only mother or only father is having allergic rhinitis, there are 20% chances the child also have it. And we have noticed that if both the parents have allergic rhinitis, there are 47%, you can say nearly 50% chances the child will have. So it is showing some gene or some chromosome is there, which is not yet discovered. I don't know the name of the gene or the chromosome, but this percentage is showing us, it is giving an evidence there may be genetic predisposition. So if one of the parent is having allergic rhinitis, 20% chances the child will have it. And if both the parents is having allergic rhinitis, there are 50% chances the child will have it. So it is indicating that genetics also play a very important role in the etiology of allergic rhinitis. People say, got it or didn't got it? So here I taught you two etiology. Okay. Now what about the age and gender? What about age and for gender? There is no predilection. Male and female have equal prevalence of allergic rhinitis. I am teaching you the topic allergic rhinitis. So it is equal in males and females. It is not more in males, not more in females. Both male and female have equal incidence and prevalence of allergic rhinitis. What about the age? It can occur at any age. It can be as young as 6 months. It can be as old as 78 years. So it can be young. It can be old. For age also, there is no particular prevalence. Most common age we have noticed 12 to 16, but it can occur in any age. So we are done with the etiology also. Can we revise? What is the definition of allergic rhinitis? It is IgE-mediated allergic reaction to the nasal mucosa in response to inhaled allergen. Types, it is of two types, seasonal and perennial. Etiology, it is having two etiology. What is the two etiology? It can be inhalant, airborne inhalant, or it can be genetics. Inhalant mein again seasonal and perennial. What I taught you the types. It can be seasonal pollen grains. It can be perennial throughout the year like the dust cockroaches. Genetics mein I taught you if one of the parent is having, 20% chance the child will have. If both the parents having, 50% chance the child will have. Coming on the pathogenesis, most important thing in allergic rhinitis, on which sometimes you get a separate question, is the pathogenesis. Pathogenesis is type 1 hypersensitivity. It's type 1 hypersensitivity. Did I taught you microbiology last year? If I taught you, you must be knowing. I teach this topic in micro also, patho also, type 1 hypersensitivity. You know the mechanism of type 1 hypersensitivity. So this is type 1 hypersensitivity. I will draw. In type 1 hypersensitivity, in human body, 5 cells, 5 immune cells get activated one by one. You have to learn the sequence of those 5 cells. So suppose this is the allergen. The allergen can be anything. This is the allergen, or you can call it antigen, foreign antigen. So suppose my allergen is dust. I'm having allergy with dust, or my allergen is particular pollen grain. So I'm inhaling it. So allergen is going inside me. As soon as the allergen enters in the subject, you know, 5 cells are going to be activated one by one. First cell which is going to be activated is antigen presenting cell. It is known as APC, antigen presenting cell. The antigen presenting cell will engulf the antigen, degrade the antigen into multiple small pieces and present them on the surface. Present it on the surface. This is antigen presenting cell. Now antigen presenting cell, after degrading it, processing it, and that's why it is known as antigen presenting cell. It will present the antigen on its surface to the next cell. The next cell here is helper Th2, not 1. Mind my words. Helper Th2 cell. CD4, helper Th2 cell get activated, not helper Th1. It comes as one of the option in your MCQ. So it's helper Th2 cell get activated. Now it will give the signal, it will secrete certain cytokines. Many cytokines are secreted, but most important is interleukin 4. Interleukin 4 will go and it will activate the third cell. The third cell in the row is B lymphocyte. B lymphocyte get activated. B lymphocyte will convert into the fourth cell, plasma cell. It will get activated and it will convert into plasma cell. Plasma cell will form antibodies. There are 5 types of antibodies: IgG, IgA, IgM, IgD, IgE. Gamma. Okay, you may have studied. Here IgE is formed. Mind my words, not IgG-AMD. IgE. Mind my words. IgE is formed. This IgE will go in the blood and it will bind on the surface of the last cell. On the surface of the last cell, the name of the last cell is mast cell. Mast cell. The 5th cell. You can see the 5 cells I have drawn. Learn the sequence for your MCQ. This is mast cell present in the blood. So this IgE antibody will go and bind with Fc fragment. This is the Fc fragment. FAB fragment is free. It is binding with the Fc fragment. You can see. Okay, this fragment is Fc fragment. Via Fc fragment, it is binding on the surface of mast cell and remain there forever. This is known as sensitization. So this process is over. So, you know, suppose I'm having allergy with dust. I don't have it, but suppose if I'm having the allergic rhinitis or allergy with the dust. So when I was born, long ago when I was born. So when first time I inhaled the dust, this may have happened inside my body. The 5 cell may get activated in my body, but I don't have any symptoms in first time. First time, no symptom. It is known as sensitization. But second time when I inhaled dust, second time onwards, anytime, any consecutive time. So when the same allergen enters second time onwards, second, third, fourth, as soon as it enters, you know, the body identify that you are the one, you have entered before also in this body. Okay, because the body have memory B cell and memory T cell. The memory B and memory T cell, they will identify that no, you are the one, you have entered before also. Maybe the first exposure and second exposure duration between them may be in days, weeks or months or years, but still memory is very strong. Memory means immunological memory. The memory B cell and T cell will identify. So memory B cell and T cell will say to this allergen, you are the one, you have entered before also and we have done the complete process for you. We will not repeat the process. You directly go to your antibody. So second time onwards, the process is not repeated. It will shunted directly towards its antibody, which is present on the surface of mast cell. So as soon as the antigen will come second time onwards, it will bind on the surface of its antibody like this. It will bind on the surface of the antibody. You can see like this. So antibody, IgE antibody will give a signal to the mast cell. Mast cell will receive the signal that the antigen have arrived. We were waiting for the antigen and antigen have arrived. The mast cell will get the signal and the granules inside the mast cell, you know, inside the mast cell we have the granules, the mast cell will burst. On receiving the signal, the mast cell will burst. This is known as lysis of the mast cell. The mast cell will burst. Once the mast cell will burst, all the granules will release out. What does these granules contain? These granules contain many important chemical mediators. 5 of them are ultra important. You have to learn the name of the 5. Histamine, serotonin, leukotriene, platelet activating factor. Okay, platelet activating factor. Histamine, serotonin, prostaglandin, leukotriene and platelet activating factor. These 5 are ultra important. Among them, the most important in case of our allergic rhinitis is histamine and leukotriene. These 2 are ultra important. Now this histamine and leukotriene is present in the blood. Via blood, what does they do? they will go to the glands and increase the secretion of the nasal glands, so runny nose. They will go to the lacrimal gland and irritate and increase the secretion from the lacrimal gland, so there is, watering of the eyes. Okay, they will go to the blood vessel and they will cause vasodilatation of the blood vessel, so redness of the external nose and redness of the face. Okay, so and they will cause increased vascular permeability on the blood vessel, so there is edema. So these are the symptoms of the allergy. When I have allergy, my nose become red, my face become red, I'm having watery nose, I'm having watery eyes. Okay, this is because of them. So who is causing all these? It is caused by histamine and leukotriene, which is present in the blood, which are present in the granules of the mast cell. This is the complete sequence. I hope you got it. If you have any doubt, please feel free to ask later on in the WhatsApp group. Please learn the sequence of the 5 cell on which you frequently get MCQ over here. So first cell is APC, second cell is helper Th2, the third cell is B lymphocyte, the next cell is plasma cell, and the fifth cell is the mast cell. In this sequence they are coming, and this is how type 1 hypersensitivity, also known as allergy, this is the pathogenesis of allergy. I hope you all got it. This is the pathogenesis of allergy. So same thing, I will show you a video also, I will show you an image also, I will show you a flowchart also. So first of all, allergy is type 1 hypersensitivity. Allergy is type 1 hypersensitivity. So first of all, there is the allergen. So antigen, allergen is antigen. It is, first of all, as soon as it enters in human body, suppose I'm inhaling it, it is captured by APC. APC will process it, degrade it, present it to the next cell. The second cell is helper Th2. Helper Th2 secrete many cytokines, but the most important is interleukin 4. Interleukin 4 will activate the B lymphocyte. The B lymphocyte convert to plasma cell. The plasma cell will form IgE antibodies. IgE antibodies goes on the mast cell and bind on the surface of mast cell with Fc receptor. And this is over. This is sensitization. Now, mast cell are fully sensitized for the next event. In the first event, there is no symptom. But second event onwards, if the same antigen enters second time, then it will directly go to its antibody. The complete process is not repeated. It is recognized by the memory B cell and memory T cell, and it is shunted to IgE antibody. IgE antibody give the signal to the mast cell. On receiving the signal, the mast cell bursts. Mast cell lyses. So from the mast cell, granules come out. This is known as degranulation. The important granules is histamine, serotonin, leukotriene, prostaglandin, platelet activating factor. And these causes the symptoms of allergy because they increases the secretion of glands, nasal gland, lacrimal gland. They cause vasodilatation. Okay, they cause edema. So because of all of them, the symptoms of the allergy occurs. So this is how allergy happens. I hope you got it, and it's ultra important. You can see the same in the form of the image. So first of all, in your university exam, you have to write down type 1 hypersensitivity. You should be able to draw this flowchart. Don't mug up, say by your own, and you can see this image. Can you see this image? So this is the antigen. Appreciate the antigen. It is entering first time. When it enters first time, it is activating antigen presenting cell. So this is APC. APC is degrading it, processing it, and presenting it to the next cell. The next cell is helper Th2. Okay, naive T cell converted to helper Th2. Helper Th2 secrete interleukin 4. That will go to B lymphocyte. This is B lymphocyte. B lymphocyte convert to plasma cell. Plasma cell forming IgE antibody. This IgE antibody go on the mast cell, bind on the surface of mast cell, and remain there forever. Now, if the same antigen enters second time onwards, second, third, or subsequent time, it will directly go to its antibody. It will bind on the surface of antibody. Antibody will give a signal to the mast cell. The mast cell will burst the mast cell. So granules will come out, and these granules will cause the allergy. Okay, these granules will cause the vasoconstriction, allergy, all the symptoms of allergy. I will show you a video. You can see here I'm showing the video directly. The antibodies are already formed. These are IgE antibody formed by the plasma cell. They are going and binding on the surface of mast cell. This orange color cell is mast cell. Appreciated is mast cell. They are binding. Now this is the antigen coming second time onwards. Okay, it is going directly to the IgE antibody. IgE antibody gives signal to the mast cell. The mast cell will burst. See the granules coming out. This is known as degranulation. One more video I would like to show you. Just a second. One more video I would like to. I guess you can see. Let me tell you. You can see here. You can see in this video. You can appreciate here. This is the inhalation of the pollen grain. So this is APC. APC is presenting it to the T cell. APC have presented it to the T cell. You can see T cell is secreting interleukin 4. Interleukin 4 going to B cell. These are the IgE antibodies which are formed. IgE antibody are binding on the surface of the mast cell. Now antigen will come second time. This is sensitization. This is over. Now the same antigen will come second time. You can see now that same person will inhale the antigen second time. This is the same person inhaling the antigen second time. So that antigen directly going to IgE antibody this time, which is present on the surface of mast cell. The IgE antibody giving signal to the mast cell bursts. See the granules coming out. See the granules. These are going in the blood, causing vasoconstriction. The main granules is histamine and leukotriene. Okay, so what we have understood now, please see, I will teach you the complete treatment here in this flowchart. You have to understand this flowchart. Please see what I taught you. See, here you can see. So as soon as the antigen is coming second time, start from second time directly. First time you got it, so start directly from second time. As soon as, because the symptoms come second time onwards, second, third, fourth, all times. Symptom don't occur first time. So start this flowchart from the second time. When the antigen coming second time onwards, any other time, not the first time, it will directly go to IgE antibody. It will directly, which is present on the surface of mast cell. Appreciate this is mast cell. Appreciate the granules inside the mast cell. So this antigen directly going, this is antigen. It is directly binding with the antibody. Antibody giving the signal to the mast cell. The mast cell will rupture. Degranulation will take place. Degranulation liberate leukotriene and histamine. It will liberate leukotriene and histamine. Say yes, leukotriene and histamine. Leukotriene and histamine will go to leukotriene and histamine receptors on the glands, on the blood vessels, okay? And they will cause the allergy. They will cause the bronchoconstriction and many other symptoms. I have written only bronchoconstriction for the asthma, but it can be other symptoms. So it is the allergy. I hope you all got it. Yes. So this is what's happening. So what are the chemical mediators are doing? Chemical mediators do vasodilatation so that, the face, the nose become red. Okay, they cause mucosal edema. The nose from inside is edematous, the face is edematous. Eosinophilic infiltration, whenever there is allergy in the blood, the eosinophils will increase. Excessive secretion from the glands, okay, runny nose and smooth muscle contraction. Okay, smooth muscle contraction, that is bronchoconstriction. So person can have symptoms of asthma also. Bronchoconstriction is asthma. I hope you got it. Okay, so this is the effect. This is bronchoconstriction, you can see. This is, so ultimately it's nasal hypersensitivity. So because of all these effects, the person have the sneezing, the person have rhinorrhea. Rhinorrhea means runny nose. Person have sneezing, achhi. The person have runny nose and nasal congestion. The nasal stuffiness, the nose is blocked, okay, nasal obstruction. So these are the three main symptoms in nasal hypersensitivity. That is the topic I'm teaching you, allergic rhinitis. So this is how it happens. This is how it happens. So you know the complete pathogenesis, yes or no? In the complete pathogenesis, it's type 1 hypersensitivity. You should be able to draw the complete flow chart showing all 5 cells and the diagram showing how does it happen. Say, can we revise or you all got it? So what's the pathogenesis, people? In pathogenesis, it's type 1 hypersensitivity. So what's happening here? As soon as the antigen enters in human body, it goes to APC. APC will capture it, degrade it and present to helper Th2. Helper Th2 secrete interleukin 4. Interleukin 4 go to B cell. B cell convert to plasma cell. Plasma cell will form IgE antibody. That will go to mast cell and bind on the surface of mast cell, remain there forever. Now the same antigen entering second time, it will directly go to IgE antibody on the mast cell. IgE antibody give a signal to the mast cell. The mast cell will burst and it will release the granules. The granules contain many things, but the most important is histamine, serotonin, leukotriene, prostaglandin, platelet activating factor. So histamine, leukotriene, they will go to their receptor. And what does they cause? They cause increased glandular secretion, vasodilatation, edema, bronchoconstriction. So they will lead to symptoms of allergy. So you should be able to draw this flow chart, draw the diagram, and explain the pathogenesis. I hope you all got it. So pathogenesis is done. So you know the definition of allergic rhinitis? Yes. Now you can understand in the definition why again and again I am saying it's IgE-mediated allergy. It's IgE-mediated allergy. Yes. It's IgE-mediated allergic reaction to the nasal mucosa, okay, caused by allergen, inhaled allergen. So this is the definition. Now you have a better understanding. Types, it is of 2 types, seasonal, perennial. Etiology, 2 etiology, inhalation of the allergen and genetics. Pathogenesis make complete flowchart of type 1 hypersensitivity. Now coming on the symptoms, there are 5 symptoms. There are 5 symptoms. 1, 2, 3, 4, 5. The first symptom is runny nose. Okay, the first symptom is runny nose. Can you see runny nose? It's runny nose. The second symptom is nasal blockage. Nasal blockage. It is congested and edematous from inside. You know, the both side mucosa. So this is the nasal septum. These are the lateral walls. You can see I'm drawing the nasal mucosa. So this is the nasal mucosa, which is lining here, which is lining here. Just below the mucosa, we have submucosa. In the submucosa, we are having the blood vessels. These are the blood vessels. Now, suppose these blood vessels got dilated. Let me draw on the neck, this side. If they are dilated, so nasal mucosa will become like this and the cavity space will be reduced. Now see the space of the cavity this side if the blood vessels are not dilated, and see the space this side if the blood vessels are dilated. This is known as nasal congestion. This is known as nasal congestion. Nasal congestion. I mean nasal obstruction. It's obstruction in the nose. Cavity size is reduced. Cavity size is reduced. Okay. And sone pe suhaga, cherry on the top. There is increased glandular secretion. So if the cavity size is reduced, although it is reduced and it is filled with the secretion, हाइपर सिक्रीशन, पहले ही कम है कैविटी साइज और वो भी सिक्रीशन से भरा पड़ा है, यू नो. सो डबल नजल ऑब्स्ट्रक्शन. सो नजल ऑब्स्ट्रक्शन के द ऑब्स्ट्रक्शन इज ड्यू टू टू रीजन. नंबर वन, कंजेशन, डायलेटेशन ऑफ द ब्लड वेसल, द कैविटी साइज इज लेस. एंड नंबर टू, increase secretions. Increased secretion is obstructing the narrowed cavity. Okay, so these are the two reasons why the people have nasal obstruction when they have nasal allergy. Okay, so nasal blockage or obstruction, increased nasal discharge is there, runny nose is there. Okay, sneezing as a protective mechanism, sneezing, and itching in the fourth thing, itching in the nose, itching in the eyes, itching in the palate, itching in the larynx, itching in the nose, itching in the eyes, palate, larynx, pharynx. So itching is there. So these are the symptoms of allergy. I guess we all know, we have seen in our relatives or patient, or you, some of you may be having the allergy, you may have experienced it. Whenever we have any nasal allergy, it's very common, allergic rhinitis. So whenever we are exposed to the allergen, maybe allergen is dust, maybe any pollen grain, so first symptom is runny nose, then nasal blockage, then sneezing, achhi, and after that, you know, itching in the nose, itching in the eyes, itching in the palate, itching in the pharynx. These are the symptoms. They are non-specific, but you should know the list so that you can enumerate. These are the 5 symptoms, or you can say 7-8 symptoms. After that, coming on the signs, symptoms ke baad the next is the signs. Coming on the signs, so we divide the signs in 5 category. What are the 5 category? Nasal sign, eye sign, ear sign, pharyngeal sign, laryngeal sign. Okay, so nasal sign में there is an important word you have to learn, allergic salute. You know, if I have runny nose, what I will do, suppose my secretions constantly I'm having unilateral or bilateral, so I will do with a handkerchief. I don't have a hanky right now, suppose this is my handkerchief or tissue paper. So what I will do, I will do like this. Can you see? So because of doing this, I will have a crease over here, and that crease is known as allergic salute. That crease is known as, that black line is known as, can you see? The patient is constantly doing like this. See, I'm doing like this. You know, so because again and again, so there will be a black color line over here, and that's known as allergic salute. I hope you are getting it. This is allergic salute. You can see, because of constantly, you know, doing this activity, because, you know, constant nasal secretion, doing it like this, cleaning it like this. Can you see my nose? Can you see a crease over here? So this crease, can you see this crease? I'm talking about this crease. It is known as allergic salute. Allergic salute. It's a very tricky term you have to learn. Okay, you can appreciate the allergic salute over here. Can you see this line? You can see this black color line. It is allergic salute. So in the nose, it is allergic salute. You can read the black color line along the middle of the nose because of constant upward rubbing. Because the secretions are coming to clean that with a handkerchief or a tissue paper, patient will do like this. Constant upward raising of the nose or rubbing of the nose. It will create a crease or black line over there. That's known as allergic salute. Okay, nasal mucosa. If you see the nose from inside with a torch, the nasal mucosa is pale and edematous. The nasal mucosa is pale and edematous. If you see with a torch, the nasal mucosa. If you see the turbinates inside on the lateral wall in the nasal cavity proper, the turbinates are hypertrophic. The turbinates are swollen or hypertrophic. So that's the nasal sign. Coming on the eye sign, the eye is also swelled. Appreciate the eye is swelled. The conjunctiva is congested. Appreciate the conjunctiva in the background. Can you see the conjunctiva? It's shiny, it's congested. In the conjunctiva, there can be cobalt stone appearance, and there can be dark circle around the eye. So these are the ocular sign. Now coming on the ear, what will happen in the ear? Allergic rhinitis, mein eye and ear are also involved. Ear may retracted tympanic membrane. If you see with the otoscope, the tympanic membrane, it's retracted. Why? Because of blockage of the eustachian tube. Now this is nose. Behind the nose, we have nasopharynx. So let me draw. This is the nose. Let me draw the nose clearly. Okay, so behind the nose, we are having nasopharynx. This is nasal cavity proper. This is oral cavity proper. Nasal cavity and oral cavity, both of them open in the pharynx. So this is pharynx. This is nasopharynx. This is oropharynx. You can see nasal cavity open in nasopharynx, oral cavity open. So it's a common pouch. This is pharynx. Okay, this is pharynx, and from here the eustachian tube is also leaving. The eustachian tube is opening in the nasopharynx and going in the ear. This is eustachian tube, and it is going in the middle ear. This is the middle ear. So if we are having allergic rhinitis, so this portion is swollen. Allergic rhinitis, this portion is swollen. So, you know, because of the swelling, this portion is obstructed. Hypertrophic turbinates and all, swelling, vasodilatation, congestion, this portion is obstructed. Increased secretion. Because of obstruction of this portion, the eustachian tube is obstructed. Since the eustachian tube is obstructed, you know, the tympanic membrane will get retracted. You know, air comes from both sides, so it's balanced, you know, in ear. So it will be retracted, and there will be otitis media. there will be otitis media. So because of blockage of eustachian tube, there is otitis media and retracted tympanic membrane. Both of them are due to blockage of eustachian tube. That is ear signs. You can appreciate the retracted tympanic membrane, and you can appreciate the fluid in the middle ear cavity. That's known as otitis media. Okay, now coming on the pharynx. In the pharynx, there is granular pharyngitis. Appreciate the pharynx. I will teach you the next topic after nose. After that, I will come on the sinuses, and after that, I will teach you pharynx only. It's a very interesting topic. In the pharynx, one of the pharyngitis is granular pharyngitis, in which multiple granules are formed in the pharynx. You can see pharyngeal granular pharyngitis. So that will happen. And in the larynx, there is hoarseness of voice because of edema of the vocal cord. You know, the two vocal cords, how we produce the sound because of vibration of the vocal cords. Okay, and with the tongue, we can convert the sound into the speech. Okay, so you know the sound ooh, it is produced by the vocal cord, and this sound is converted into speech, whatever I am talking, with the help of the movements of the tongue and the teeth and the mouth. Okay, so this vibration of the vocal cord creates the sound. Now imagine if the vocal cords are edematous. They are edematous. Okay, so there will be hoarseness of the sound. Okay, so these are the 5 signs. Can we revise it? In the nose, there is allergic salute. It's allergic. Never forget allergic salute. Okay, nasal mucosa is pale, and the turbinates are hypertrophied. The eye is swollen, the conjunctiva is swollen, there are dark circles around the eye. Ear may blockage of eustachian tube. That will lead to retracted tympanic membrane and otitis media. Okay, pharynx may granular pharyngitis. And larynx may hoarseness of voice because of edema of the vocal cord. You can appreciate the 5 signs. See the nasal sign, see the ocular sign, see the otolgic or ear sign, see the pharyngeal sign, see the laryngeal sign. Appreciate it. Okay, rather than mugging it up, see the picture and understand it. So these are the signs. So I taught you 7, 8 symptoms. I taught you 5 signs. Don't learn the number. How many you can remember? The main one you should learn.